get started. We are slide number 3 right now. So this is who we are and why we're here. So I think many of you guys may already know we are the South Coast AQMD. We are a regional government agency, and the district includes Orange County and the metropolitan areas, non-desert portions of LA, Riverside, San Bernardino counties. So pretty big coverage area, which includes this area where we're at here. So earlier this year, there was a settlement between the South Coast AQMD and SoCal Gas that allocated $1 million toward a health study of the impacts of the big gas leak at Aliso Canyon and the resulting emissions. I do want to mention, that's not on the slide, but I do know that some of you guys have heard that earlier this year, while we were preparing for the court case, there was a $40 million health study budget that was discussed, but AQMD settled with SoCal Gas, and the amount allocated was $1 million for the health study. Now, I know we can be disappointed in that outcome. What we're trying to do tonight is to say, look, we do know what we have. We do know at this time we have $1 million, and I think what we're trying to do is to just maximize how this $1 million is spent, to make sure we get some useful and credible, scientifically valid information that will be helpful to this community. So that is what we're trying to do tonight. So again, we had a group of technical experts. So these are scientists from different agencies, local, state, and federal agencies, as well as 2 faculty members with expertise in toxicology and epidemiology. This was a working group. They drafted a draft study scope that tried to identify some of the most useful studies within this budget, and as well for the agencies to identify any additional resources that can be put toward this effort. Again, in an effort to try to maximize what we can do in this effort. And so today, again, that scope is considered draft. Today, what we're trying to do is gather community input, which is really essential to this process in order to get to a final scope of the health study. So we definitely want to hear your input. We definitely need to include that into the final scope as best as we can, and so that is why we are here tonight. Okay, so some background about what's already been done and kind of where are the data gaps and kind of what are we trying to do at this stage. So what has been done, so during the end of 2015 to 2016, there were many samples of pollutants that were collected in the community. So this includes air monitoring, air sampling of different sorts and different locations throughout the community. At the time, in fact, we actually calculated some of the health impacts based on the air toxics that were measured. And again, this is particular to air pollutants where they have no toxicity, for example, such as benzene. And we did a health impact summary, which has been on our website actually for quite some time, and I provided the link so you can look it up there as well. There was also some indoor environmental sampling, so for example, wipe samples and air samples that were collected. This was done by the LA County Department of Public Health, who also conducted what's called a CASPR study, which included a survey component that asked about health symptoms that folks had experienced or were continuing to experience at that time. So where does that lead us now? So, what are some of these open questions? So one, we know that this community has experienced some health problems that, the existing environmental sampling, just could not explain. And the idea that this working group had was that, we really need to, it would make a lot of sense to look more closely at those health symptoms that people have experienced or continue to experience. In addition, another data gap is that there isn't a lot of information known about the toxicity of the odorants that are added to the methane gas. These are called the mercaptan odorants. So that is another data gap that exists right now. So I do have 3 slides that talks about kind of who's doing what and the different names that we're giving these groups. And the process, just to make sure that we're all on the same page. When we say working group, what do we mean? When we say the HS tag, what do we mean? So first, the working group is this kind of group of experts, scientists, and researchers from the agencies and 2 universities. And those are the folks who developed the draft scope. Okay? Now, what we're going to do is we're going to take all the folks from the working group, and in addition, the Porter Ranch Neighborhood Council has identified 2 community members, and those 2 community members plus the working group is going to get together, and that's going to form the Health Study Technical Advisory Group. And the purpose of this group is, one, to provide kind of technical guidance on the study scope, the progress, and the findings, to help integrate the community input into the final study scope, and to help provide updates to the community and also feedback to the researchers from the community as well. Okay? And that leads me to the next group, which is the community, members of the public. So we do rely on members to provide input on the study scope, to participate in the study, and also provide feedback on the study progress and findings when we get to that stage. Okay? There's going to be, if this goes through what's called a request for proposal, RFP process, it would go to a proposal review panel. So in other words, when researchers put together a proposal, several researchers can submit their proposals, and they need to be scored and ranked to decide essentially who's going to get the funding, right? And so this goes through a proposal review panel. These are scientists with expertise, depending on what the nature of the proposals are. And then, of course, the researchers are the ones who are actually going to be conducting the study. So those are the folks who are going to be designing the study, and they are also going to be involved, of course, reporting the progress and findings, not just to the Health Study Technical Advisory Group, but of course also to the community as well. Okay. A little bit more on this Health Study Technical Advisory Group, also with the acronym HS TAG. So what are they going to do? So before the study begins, again, integrating all the community feedback into the final study scope, while ensuring, of course, that the proposed scope is still scientifically valid and would provide really meaningful, valid data. And also really prioritize the study components and elements that are going to be part of this final scope. And so basically, it's going to be a scope document that will go into either a request for proposal or a sole source contract, if that's applicable. Okay. Now, once the researchers have been selected to conduct the study begins, and then after the study begins, this HS tag still has a role. They will conduct a periodic kind of review of the study progress and interim findings to make sure that things are kind of going along on track. And if the study, for example, runs into a snag, the technical advisory group can be there to kind of figure out the best approach to move forward. Right? They can address the community questions or concerns about the study, which is one of the reasons why it was so important to have some community members to be part of this advisory group. And of course, again, providing regular feedbacks to the community and also technical feedback to the researchers. Okay? I do have a note at the bottom saying that, because this technical advisory group has a role in finalizing the study scope, the members of the technical advisory group cannot then apply for funding to conduct the study, because that would be a conflict of interest. Okay, the process and timeline. I'm sorry the font is a little small on this, but I think we do have copies of the presentation if you had not picked it up right here in the front of the room. So in the last 2 months, basically the working group had drafted the scope, and the Porter Ranch Neighborhood Council has identified the 2 community members to serve on the technical advisory group. In the coming few months, we are gathering the community input on the draft scope. The technical advisory group will then integrate that community input into a final scope. That scope will go into a request for proposal or sole source contracts, and then the AQMD will be issuing what's called RFP, request for proposal, or the contracts. Okay. Approximately middle of next year into the early fall, if this goes through an RFP process, a request for proposal process, then it's going to be reviewed by the proposal review panel, reviewed, scored, and then our AQMD board has to authorize the funding for the studies. And at that point, then the research can begin the study. The researchers can actually begin the study. Okay. Once the study begins, again, the technical advisory group you would meet about quarterly to discuss the progress, again, provide input to the researchers as needed, and also provide updates to the community. Okay. So we are now, to make sure we're all on the same page, we are now on slide number 8. So when the working group met, these were the kind of health study components that were identified as the most useful activities within a $1 million budget. Now you can see that one item, the first line is 1 million, the second line is 500,000. So again, these are options, and today we're here to discuss some of these options. In addition to those ones with the dollar amounts, the next 3 lines you can see there are other components again identified as being some of the most useful activities by this working group that these agencies are proposing to conduct that don't count into the $1 million budget. Basically, there are kind of other resources to be able to do these. So one is community engagement, a record space. I'll go into these more in detail in the next slides. I'm not going to spend a whole lot of time kind of walking through this one. But in essence, we're talking about kind of 2 options, options 1 and option 2, which I'll describe in a little bit, and some other activities that we're trying to do through the various agencies that are not going to be charged for the $1 million budget. Okay. So the last slide, slide number 8, were some of the kind of most useful activities that were identified. In addition to those, the working group also identified some other possibly useful activities, and this includes what's called a records-based epidemiologic study. For example, if there is a large private medical provider that provides a majority of the services, or a large proportion of the services in the particular study area, for example, in some areas, Kaiser, may be an example. Then potentially it could be a study used that draws from that kind of data. The second one is establishing what's called a health registry. And so this can take a number of different forms. So essentially it's basically either a population registry, which is kind of tracking folks who have certain who maybe lived in this area or lived in this area during the time of the gas leak. Or a health registry could also be tracking folks who have a particular type of health condition. So for example, I used to work for a tuberculosis registry, so we would track everybody who had tuberculosis diagnosed in LA County. So that's just one example. Okay. So I'm going to walk through some of these study components that were in that list. So first, we're going to talk about these study components that the agencies are proposing to do. Again, in addition to, so not counting into the $1 million budget. So first, community engagement. So we coordinated this meeting. We've certainly been working with our local groups such as the Porter Ranch Neighborhood Council. And our gracious hosts at the school to be able to conduct this meeting and to gather the feedback from all of you. We'll be creating this health study technical advisory group, arranging those meetings. I should mention here that I did get a question about whether the health study technical advisory group meetings will be open to members of the public. The answer is yes. So members of the public will be able to attend those meetings once they are organized. We don't have anything scheduled at this point, but we will. In addition, to keep the public informed in terms of progress, we will also have additional meetings in the community to give updates on the progress of the research. Okay. Now, strengths and limitations real quick. Of course, we want to make sure that the community input informs these study priorities and the final scope. We definitely want to encourage public participation and transparency, and also, very important, keep the public informed about the progress and the results. Only limitation I can really think of is the time commitments for everyone. So, the second one is what we call a records-based epidemiologic study using public data. Okay, so what this means is that all hospital admissions, so basically anytime a person goes to the hospital or goes into the emergency room visit, that information is recorded and it's also reported to a state agency called the California Office of Statewide Health Planning and Development, or OSHPD, as the acronym. And so the proposal in this study is to use that data from hospital admissions and emergency room visits, and we can look at, for example, a Porter Ranch area or whatever area is identified as kind of the high priority area to look at and compare to other areas. So what information this can provide, I'm sorry, I've got allergies here. It's been 2 weeks, but anyway.
Exactly, 2 weeks ago they released them all.
So what information this could provide, this kind of analysis can look whether certain serious health conditions, other conditions where people would go to the hospital to get services or go to an emergency room to get services, can look at kind of trends and patterns in those particular conditions, and look over a different span of time, and look over different geographic areas. And so for this activity, for this study component, the LA County Department of Public Health, with technical assistance from the California Public Health Department, they are proposing to do this work, again, outside of the $1 million budget. Okay. Some of the keys about this kind of study: one, you certainly have the ability to look at data over a lot of people, a lot of different areas, and a lot of time. You can look at a lot of different health problems because it's anything captured in these hospital admission records or emergency department records. You've got a complete database of those. It includes both public and private hospitals, and you can compare across different communities and time periods. Now, there are some limitations. One, if there are conditions where people don't normally seek care at a hospital or emergency room, obviously that would not be captured in this data. So there are certain conditions that, really this kind of study, really would not be able to study very effectively. But it would be able to study the more serious conditions where people will go to the hospital or emergency room. You may not be able to account for certain other factors that might affect your health risks. So, for example, maybe some other risk factors that are not captured in this data. For example, I believe like smoking information or other health conditions that could affect a certain risk of certain health symptoms or health conditions. Okay. And finally, one limitation, and this is really true of any epidemiologic study, not just this one. It's really not possible to say whether the exposures cause health symptoms in a specific person. When we do epidemiologic study, we talk about risk, we talk about odds, we talk about chances, but in terms of a particular person, the science is not able to do that. The third component that I want to talk about, again, outside the $1 million budget, is what's called these Toxicity Screening assays, sometimes also called high throughput screening assays. So these are, I'll go through the description first. So basically it's like a laboratory test. And they can test different types of chemicals. And the idea here was to see if we would be able to test the odorants that were used at the Aliso Canyon facility through the US EPA, what's called the ToxCast program. So what does this do? What does this do for you? It provides what we call screening level information about the potential toxicity of these compounds. And again, the EPA has tested a number of different compounds, and they have this program. However, there are some kind of methodological kind of issues right now when it comes to testing this type of compound. So I think we are still continuing to work with US EPA to see if this is possible. But if this is possible, we're going to see if EPA would be able to accommodate this kind of request to be able to run these particular odorants through this kind of toxicity testing. Okay? And what it tells you is that, you know, if, for example, if there's a compound that, you know, where a lot of, you know, assays light up, then that would be a higher suspected toxicity than the compound where not very many things light up, right? And so basically it helps kind of prioritize, you know, what chemicals may, you know, may want, what you would want to go on to more traditional toxicology studies, okay?